That's pretty much an all-time low since the very beginning. And we're reporting zero deaths. And that's the first time when we reported back-to-back 0 deaths. It's the first time. Because we've been averaging like 1, and then we went up to at one point in time 3. Then the maximum number was 5 deaths at one time. But this is the first time when in 2 consecutive days, 0 deaths, and then with 20 new cases. Now we'll take that for today. Tomorrow it could be different, but hopefully not. But it's another indication that the social distancing, the wearing of the face coverings, staying at home, working safely, all of those measures in combination, those measures are working. And then even with, and then we're having increased testing. For another day other than Sunday, since we had to close because of the weather, we have maxed out our testing capability at both sites. So this is another day in which we've reached 1,000, and we have done it, before 4 o'clock. So we just need additional supplies in order to build on our capacity, so we can test more at the 2 public sites, as well as have testing throughout the communities. And that's what we're working on now, because we need the testing to be more widespread and robust. That would be very, very helpful for us. So I'm pleased to make that report, and let's hope that it continues. Now, with respect to, we know not only are there health challenges, but there are food insecurities in our city across the board. And you've seen them, we've all seen them. And Gabe Caceres, Director of Mayor's Office of People with Disabilities, and his staff have been working to meet the needs of people with disabilities in our community. And again, we don't want to leave anyone behind. And there are some people who cannot, let's say, go and get to the food distribution centers. And so this center has been set up, turned the West Gray Multi-Service Center into a kind of like a storage, food storage area. I want to acknowledge them. One, of course, Gabe again, and then Walmart, Sam's, the Houston Food Bank. Melody is here. Melody Payne here is representing them, and Metro, because it's Walmart and Sam's that have, and the food bank, Houston Food Bank, that have contributed all of the food that you see here. And then Metro is taking the food to people's homes where they live. And they will be, it's all being put in boxes, and then these boxes with Metro support will be taken to people's homes. So it is an incredible operation. I want to give a huge thank you to all of these partners who are collaborating, who have come together to make this happen. And so, Gabe, let me stop, and why don't you give further explanation?
Thank you, Mayor.
Right over here, get right behind.
Thank you, Mayor. We are so grateful for our partners at Walmart, Sam's Club, the Houston Food Bank, and Metro that are working with the Mayor's Office for People with Disabilities to pull this off. Walmart and Sam's Club contributed about $30,000 worth of goods, and the Houston Food Bank has made a substantial contribution as well as providing transportation for all of the food that you see here. So the way that this is going to work is that people with disabilities can access the form for our food access program at houstontx.gov/disabilities, or they can call our office for assistance on filling out the form at 832-394-0814, and we will be working with Metro to get the food to people's homes. And I want to thank you, Mayor, for your support and for always considering people with disabilities as the city recovers from COVID-19.
Thank you, Gary. And let me call on Melody with the Houston Food Bank. The Houston Food Bank has just been incredible. They represent, they're the largest food bank in terms of distribution in the entire country, so hats off to the Houston Food Bank. Melody.
Thank you, Mayor. Thank you so much. I'll keep it short. As you all know, we've been distributing all across our 18-county region, all the way up to Trinity County, all the way down to Galveston. Currently, we're operating at 150% of our usual distribution, and a lot of our partner pantries operate, getting food out to folks, 250 families here and there. Currently, they're doing double. Currently, they're doing double their current distribution, sometimes triple. And so we're really, really grateful for partners like Gabe and partners all across this county who help us to do this work because we couldn't do it alone. So, you know, we're known for doing big scale things, but we got to be able to do things at the community level where the community is. So thank you all so much for your support, and thank you, Gabe, for creating this partnership. Got to get a spin in mouth.
And you don't have to go to the grocery store. You know, they've got all the essential items that's just very difficult to get even in the grocery stores. Thank you, Gabe. I'm gonna set this right here. You know, don't take it. But to complete the form, you know, for those who are in need of assistance, these boxes, you can call 832-394-0814. 832-394-0814. Fill out the forms, and the food distribution will start on Friday. We'll box them up today and tomorrow, and they will start on Friday. And one of the things, we don't want to leave any community, any of the people in our city behind, and so this is very much appreciated. And if people want to continue to make donations, you can either go through the Houston Food Bank, or you can just make donations available right here at West Gray Multi-Service Center. Now, in terms of just the reports, Dr. Purse?
Thank you, Mayor. As the Mayor pointed out, 20 new cases today, which is comparatively a very small number to what we've seen in the past. Remember, we had one day where we had over 600 new cases. So this is good news. It's my job always to have our guard up, and so if this continues, I'll feel a whole lot better, but certainly to have a day with only 20 new cases and no new deaths, and 2 days in a row with no new deaths, is an apparent change in our trend. But we cannot drop our guard. And I say that to everyone. We cannot drop our guard. So today you see I have a very colorful face covering on, and that's because yesterday when I talked to you, I had the bandana style, and the mother of one of our firefighters didn't like the fact that I looked like a bank robber, and so made this. So the point is, this was made. This didn't exist 24 hours ago. This face covering didn't exist. She was able to make it very quickly. And the face coverings, along with the social distancing and everything else, are going to be so very important. The numbers today, the reason that there's 20 and not 100 like there were yesterday is because people didn't infect the other 80 people, if that makes sense. That's Houstonians doing what we're asking Houstonians to do, and I cannot underscore enough how important it is and how proud everyone should be about that. Simultaneously, we're working with the health community. There was a meeting this morning where we spoke with the leaders from the Texas Medical Center. We do this twice a week, and you know, the signs are encouraging. But as I've said before, and as the mayor has said repeatedly, this is not the time to drop our guard. It's the time to redouble our efforts and continue to protect Houstonians.
Thank you, Dr. Purse. In fact, in the numbers that I saw this morning in reference to our hospitals that are a part of the Texas Medical Center, the numbers reflected that more people are being discharged from the hospitals than those who are within our hospitals being treated for COVID-19. So that's a very positive report. Very, very good news. And again, so let me encourage people, social distancing, staying home. The face coverings is important. I don't want to underscore that because I think there's a large percentage of people who are asymptomatic, which means you feel great, but that doesn't mean you cannot infect someone else. So really emphasizing the importance of face coverings, going to put special emphasis on that, especially while we remain in the month of April. So you're going to be hearing a lot more about the emphasis on wearing face coverings. Chief Acevedo.
Thank you, Mayor. Good afternoon, everybody. First, I want to thank the Houston Food Bank. I mean, you and everyone that supports them. This is just amazing to see this kind of work being done across our city. For the police department, our update for cumulative numbers for COVID, we currently have 73 members of the department, 73 members of the department in quarantine, 45 uniformed, 28 civilian. We've had 179 employees tested, 41 have come back now positive, 40 uniformed, and 1 civilian. The good news is 24 are back to work out of that number, which tells you that we've got some great medical and some great outcomes. Officer Cervantes continues in the hospital. He's still in a ventilator, but we still have hope. And again, His wife contacted me this morning, Liz Cervantes, who's doing really well with her exposure, and she just continues to ask and is very thankful for the prayers, continues to ask for prayers. In terms of our arrest, our felony arrest levels for the police department, which speaks to the fact that we are 100% operational, are at our historical numbers. They're consistent with historical numbers. Our misdemeanors arrests are down, and that is by design. And our calls for service as of today are down about 3% during this COVID period. So if you need help, let us know. Burglaries of buildings are still up at about 28% since COVID-19 occurred, and our assaults are still up about 10% as of today. Many of them are domestic violence related. So again, if you need help, call us. We're here. And most importantly, our partners are here with the Houston area's Women's Shelter Center that can help get you out of a dangerous situation. And so with that, that's my report, Mayor.
Thanks, Chief. Okay, we'll take any questions you may have.
We have full questions over here from Kate for you, for Dr. Purse. Is there a specific number of positive cases or a daily testing that you're looking to hit before you can declare Houston's COVID-19 peak has passed and the city can begin to reopen businesses?
Yeah, that's a really difficult question. And the reason it's a difficult question is there isn't an absolute number. It's the shape of the curve, if you will. And if you consider how every day we get cases, and we've talked about the lag in the reporting from the labs, so anytime you look at that curve, it starts off low and it comes up, and then on any given day, it looks like it's doing this. But that's because the labs aren't going to report on these days until several days later. So the curve always looks like that. So what I'm looking for is the overall shape of the curve, not just the last week or so. The shape of the curve of the last week is unfortunately pretty unreliable because of the lag. And so there's not an exact number. It's going to be the shape of the curve. And so we're not quite there yet. But as you're reporting the numbers, you're seeing that they seem to be trending in a good direction. So it's way too early to say there's not a number. It'll be the shape of the curve. And one thing I want to do while I've got the microphone is with this mask. This is I said this was made by the mother of one of our firefighters. So I want to thank the mother, Mrs. Richter, the mother of Captain Richter, who made this. She made this yesterday, and I just think it's worth actually thanking her personally for going to the trouble of making this mask for me.
Probably another question for you, Mayor, from the poll questions. What percentage of Houston's positive COVID cases have been asymptomatic? Sorry, Dr.
Oh, that's you.
Sorry, what's that again?
What percentage of Houston's positive COVID cases have been asymptomatic?
So I don't know about for us. I mean, I can get that for you. I don't have it on the top of my head. But looking at the national numbers for being asymptomatic, well, so asymptomatic or pre-symptomatic, it's probably in the 80% range. That's what we're seeing across the nation.
And one last one from Kate. The Walgreens drive-thru site was supposed to deliver results within 24 hours. However, one of their viewers said they waited more than 3 days for results. Is there a faster way to get results?
All right, so that's a question for Walgreens. We unfortunately have no control over that. But I can reach out to them. Now that you've told me that, I will reach out to their folks. We know who their leadership is, and we'll find out if there's an issue there that we can help them resolve.
Mayor, question for you. Friday, curbside retail is set to begin. This is two-parter. It's set to begin. Do you have any concerns about that? And the governor said today that next week he intends to issue an executive order to override any local orders. Are you concerned about that?
Let me deal with curbside first. Curbside is pretty much consistent with what we've been doing with our restaurants. You know, we allow curbside service there, and I'm assuming it will operate the same. I guess my only concerns is whether or not when you're dealing with retail within like malls, are we opening in the malls? So I don't quite know logistically how that would work, but from a general sense, curbside service, you know, I don't have a problem with. With respect to the governor's order overruling the local orders, I mean, he's the governor. So the only thing that I would, what's important to me, and I think what's the important point, is the testing. And I think we're all anxious to hear what is the state's plan as relates to testing. Because you can look at these numbers all you want to, but the numbers measure the people who have tested or people who have come into our hospitals and have been treated. But just like you can look on the radar and determine where a hurricane is, the testing determines, let us see, where the virus is located. And until the testing becomes more robust and widespread, we really don't know where the virus is. And so we can say we're either close to the peak or we're at the peak, But if you don't know where the virus is and you start opening up too quickly, then you're going to be running right in the midst of a storm one more time. So it's testing, robust testing, the plan for testing, the plan for contact tracing, all of those. That's the critical component, and that's what I'm waiting to hear. Okay.
So do you think the current plan is laid out by the governor for opening retail is cautious enough, slow enough?
When we're talking about curbside, you know, that's consistent how we're treating the restaurant. So I don't have an issue with that. I don't have an issue with closing schools for the rest of the academic year. I'm fine on that end. I don't have a problem with the state parks opening with the conditions that have been put in place. But once you go beyond those particular measures, the question is, what's the precursor to that? And that's robust, widespread testing. And if you don't do the testing and have a plan for that, and it's systematic and widespread, then you're flying blind. You just don't know where you're going, and you don't know where the virus is.
Is there any indication, or do you know? I mean, Dallas has extended stay-home order until May 15th. Where are you in what someplace like Dallas has done, what the governor has done, and will you sort of, like, people just want to know where are we at as far as restaurants being open, or, you know, the hair salon, or you know, services, things like that. Do you anticipate that happening, or will you require, like,
Well, let's put things in their historical context. When this virus became noticeable, let's say even more noticeable, things were handled on a local level by the cities and the counties. So, for example, in the first week in March, those were local decisions to reschedule or cancel conferences and conventions. On March the 11th, for example, dealing with the rodeo, those were local decisions. With respect to March 17th, when we suspended the business of restaurants, the dining facilities, except for curbside service or pickup, closing restaurants and bars, initially those were local decisions. After cities and counties made the decision, the governor came in. When we came to the stay-home orders on March 24th, those were local decisions. And if you can recall, it was the governor who said on that Sunday, I'll never forget, that he was leaving it up to the cities and counties to make those decisions. Those were local decisions. And then the governor came back and put in his order, but those orders had already been put in place by Dallas, San Antonio, Austin, Houston, and the surrounding counties. So now, it is true, as the governor, he has the authority to set the timelines and in terms of what opens up. And his order will supersede counties and cities. My concern is it is important for all of us as much as possible to speak, to put forth the same message so that the messaging is not confusing and people don't have a misunderstanding. Because when you've asked people to stay home and to make huge sacrifices for 35 to 40 days, you know, naturally, you know, they're anxious to get back out. And they're listening to us to say, is it okay? Is it safe? Are we going to be all right? And if the messaging becomes conflicting, it becomes very difficult to ask people to continue to make these sacrifices. And we all should be governed by the facts on the ground, the medical advice that we're getting from the professionals, the hospitals, you name it. And so that's what's important here. And so I'll take my cue from the medical professionals, and I'm just continuing to ask people to be patient as we move forward to reopen.
Chief, do you have any comments from the Chronicle regarding the Texas Organizing Project paying bonds for a lot of people in Harris County jail?
I think that's their prerogative. You know, the bond issue, if somebody has a bond pending and someone pays for them, that's their prerogative to do that. But again, my position is bonds shouldn't be about money. It should be about the threat posed by that person. And so, you know, let's hope that the judges make good decisions when they set bond.
Is there any way the mayor could just briefly address, to clarify for people, the city's getting like a couple $100 million from the feds, but you're still working on the fact that, can you explain how you can't use that money to pay for what you really need, which are salaries of firefighters, so could, then the city wouldn't have to
Right.
pay out people.
From the Federal CARES Act, the city of Houston, just like the counties, the cities will be receiving X amount of dollars. Those dollars can only be expended on items that are directly COVID related, not previously budgeted, and they have to be, the expenses have to be incurred or obligated by the end of the year. So if there's anything that's currently, for example, in your budget, you cannot use those federal dollars for. So COVID related, directly COVID related, not previously budgeted, have to be encumbered by the end of the year. So anything, for example, let's say starting in March going forward for the rest of this year, those dollars you can utilize. And so what the cities across the board, 111 mayors in Texas, wrote a letter to Congress saying, in many ways, you don't have to appropriate us any more dollars, just allow us to have flexibility with regards to those dollars that have already been awarded, so that, for example, where we've lost sales tax, which directly will impact police, fire, municipal services, allow us to use the dollars that the federal government has already awarded to fill in those revenue shortfalls, those holes. And we've been asking for flexibility in that regard. Otherwise, the 5 cadet classes that are desperately needed, police cadet classes, I might add, though they are going to be deferred. Employees that we desperately need for city services, they will have to be furloughed. So those are the things that will have a direct impact. It's hard to say open up this economy, open up cities and states, if the governmental unit that provides the infrastructure to all of these private businesses and nonprofits pretty much are having to continue to shut down themselves. So in Houston's case, for example, we calculate that amount to be right around $400 million. Oh, and let me just make this, because this is an important note. The federal government's model fits New York City and New York State, because in New York City, for example, they set up a lot of hospitals. You know, they put up a lot of structures because they needed the excess capacity. In Houston, for example, we started early in shutting down things, closing things on. And so we haven't had to expend a lot of dollars in brick and mortar and setting up things. So the model fits, let's say, the East Coast and the West Coast, but it doesn't necessarily fit those of us in Southwest. And so we are simply asking, give us the flexibility where we have lost sales tax and sales revenue. Give us the flexibility to use what you've already awarded or appropriated so that we can fill the hole directly caused by COVID-19.
One for Dr. Burgess. Do you have an estimate of how many cases of COVID-19 have been conducted in Harris County?
So real quick, because I guess we got to go, but real quick, no, I don't, because they have to report to us the positives. They don't report the negatives, so I have no idea what the total number of tests done is.
Dr. Parks will be around, as well as Acevedo and Gage. And Melanie, please help us promote the food assistance program, because it is very important to people with disabilities.
Can we get something in Spanish from Gabe?
Gary, tell me get something in Spanish. Did you want Gabe to do it, or did you want me to do it?
La oficina del alcalde para personas con discapacidades está anunciando el programa de asistencia alimentaria para personas con discapacidades. So, lo que va a pasar es que la gente puede acceder a nuestro sitio web, houstontx.gov/disabilities, y llenar el formulario, y al llenar ese formulario, nosotros en conjunto con Metro vamos a llevar una caja de donación de alimentos hasta sus hogares, gracias a Walmart, Sam's Club y el Houston Food Bank, que son nuestros compañeros en este programa. Y si no pueden acceder al sitio web, nos pueden llamar a nuestro número telefónico al 832-394-0814.
¿Cuántas cajas más o menos o qué meta tienen para repartir? ¿Cuántas familias, cuántas personas discapacitadas van a recibir?
Estamos tratando de ayudar por lo menos a 500 hogares.
esta comida es para su casa. This food is for your house.
Yes. Oh, Art, thank you for being here. Thank you. And thank you for your help.